welcome back, everyone, to the Thyroid Stimulating Podcast. This podcast was created in partnership with the American Thyroid Association to discuss up-to-date diagnosis and management of a wide array of thyroid diseases. I'm your host, Dr. Kaniksha Desai, and today we're exploring a fascinating topic that often flies under the radar, selenium and its role in thyroid health. Selenium is a trace element with the powerful antioxidant properties, and it's pretty much crucial for the proper function of your thyroid gland. In fact, it's essential for the conversion of thyroid hormones, and research suggests that selenium supplementation may help reduce inflammation in certain thyroid conditions like thyroid eye disease. But how do we know how much we need, and can it really make a difference in managing all thyroid disorders? And lastly, how do we ensure that we get enough from our diet? Stay tuned as we unpack these questions and more with insights from the latest studies and practical advice for your patients. Joining us today is Dr. Trevor Angell, an Associate Professor of Clinical Medicine in the Department of Medicine's Division of Endocrinology and Diabetes at Keck School of Medicine of USC. Dr. Angell's clinical research focuses on the diagnosis and treatment of thyroid diseases, including thyroid nodules, thyroid cancer, and thyroid disorders during pregnancy. He has published numerous articles in JAMA Surgery, Thyroid, and the Journal of Clinical Endocrinology and Metabolism. He is also currently the editor-in-chief of the American Thyroid Association's journal, Clinical Thyroidology. So thank you so much for taking the time to join us today to talk about selenium and the thyroid gland.
Thank you, Dr. Desai. It's a pleasure to be here.
Okay, so I wanted to start with the basics. So what is the role selenium plays in thyroid health? How does it influence thyroid hormone production and metabolism?
Thank you. Yeah, well, selenium is a trace element found in the environment, and it turns out to be an essential component of some critical enzymes in the body, including those for thyroid hormone metabolism. So these are the deiodinase enzymes, of which there are 3, and they're called selenoproteins because of the presence of selenium in their structure. And these deiodinase enzymes are responsible for production and conversion of thyroid hormones in the body, such as T4 to T3 within the tissues and within the cells. And that means that the deiodinase enzymes are really important to thyroid hormone actions in the body, and they need selenium. So it is a crucial piece of thyroid hormone production and how we use it.
So along those lines, a lot of people are concerned about selenium deficiency. So can you tell me a little bit about the symptoms of selenium deficiency and how that would directly affect how your thyroid functions?
So selenium deficiency, fortunately, ends up being pretty rare. But there are populations, because of where they are, that are particularly selenium deficient. And we know from looking at those people that severe selenium deficiency can involve myocarditis, cardiomyopathy, muscle weakness and pain, hypopigmentation, white nail beds, hypothyroidism. I think mild selenium deficiency may have symptoms that are much more nonspecific or often no symptoms at all. But muscle joints and pains are certainly something that's been listed as potentially problematic. Anemia as well, and again, problems with nails. Even though thyroid hormone conversion would likely be reduced with selenium deficiency, somewhat surprisingly, we don't see as much hypothyroidism in selenium deficient populations as we might expect, even when selenium's relatively deficient. And so, that may be because of other compensations that may exist. But we may not be able to see thyroid hormone abnormalities when selenium is low in all people. Now, another effect on thyroid function is thyroid autoimmunity. And that's a little bit of a separate question, where selenium has a lot of roles in the immune system as well. And an association with thyroid autoimmunity is something that has been observed across a lot of studies.
So I wanted to go back just a little bit. Who's this population that's at risk? Are you and I at risk, or there's a certain group of people that might be at risk?
Sure. Well, as I mentioned, the environmental presence or absence of selenium, it represents one of the major risks. So, in places that have a selenium deficiency in the soil, traditionally has been a group that's very at risk. Now, because of the movement of food, because of supplementation that exists in a lot of places, that is really not a significant issue in the United States, but certainly may exist significantly globally. Other populations that really need to be aware of it can be strict vegetarians, because even though selenium will be in some plant products, meat products that have concentrated a lot of plant sources are a rich source of selenium. And then, those people with some other medical conditions, so people who are on hemodialysis, people living with HIV, and those on parenteral nutrition are all at risk for selenium deficiency.
What about patients with gastric bypass? Some of our patients do get that for weight management.
I think that is less clear, but I think it's certainly worth noting, given the range of deficiencies that they do have, that could be a problem as well.
Okay, so a very small population overall, but it's still important to consider. So tell me more about this link with thyroid autoimmune diseases like Hashimoto's and Graves' and thyroid eye disease.
Absolutely. So another place where selenium has a critical role is in antioxidant activity, such as glutathione peroxidase and other places. And so this may broadly relate to inflammation and free radicals in particular. And so the effect of selenium in cells can be to, increase the antigen expression and how immunologic they might be. Selenium, for example, could lower the reactivity of T cells and increase regulatory T cells. So that affects the immune balance and local inflammation. So what does that all mean for the thyroid? Well, deficiency of selenium, an increase in free radicals, may cause some thyroid damage and responsiveness of the immune system, which is then activated and creates things like thyroid autoantibodies, like thyroid peroxidase that we see in Hashimoto's. And then that in turn is going to affect thyroid function, most usually with hypothyroidism in some people.
Tell me a little bit more about thyroid eye disease and the inflammation and how selenium improves that inflammation.
Yeah, absolutely. This is an area where we have some really good data. And this comes from a New England Journal of Medicine article in 2011, which was a randomized controlled trial of patients with mild thyroid eye disease who were treated with 100 micrograms of selenium twice a day or placebo. And what this study showed was improvement in eye involvement, progression of thyroid eye disease, and quality of life. 70% of the patients treated with selenium showed improved quality of life compared to only 20% in the placebo group. Now, these were mostly inflammatory signs rather than proptosis, which has become a subject in more recent studies, but really an evident benefit for selenium in these patients.
So I think you said it. So the recommended dose, at least for thyroid eye disease, was 100 micrograms twice a day would be what we recommend patients to get.
That was the dose in that study. Other studies have used 200 micrograms once a day, but 200 micrograms per day total.
Okay. So what happens if I take 400 or 600 or 1,000? Is more better?
Unfortunately, more is not always better. The recommended dietary intake of selenium is around 55 to 70 micrograms per day. And so those treatment doses are a little bit higher than that. Most recent data on the average intake in the United States was around 100 micrograms per day. and the upper limit is considered to be 400 micrograms per day. So what happens if you do take too much? There have been cases of supplements that were mislabeled where patients have had received too much, or unfortunately people who did think more would be better. And there are symptoms of acute selenium toxicity that can include muscle tenderness, tremor, flushing, GI symptoms, hair loss, even as far as heart failure or kidney failure. So it can be very serious.
Okay, so we want to get like the correct amount, which is more than the daily recommended dose of 50 micrograms. We're shooting for around 200 and micrograms, and 400 is kind of the max recommended. So you talked a little bit about supplements. So that's one way of getting selenium. But if somebody wanted to be a little more natural and get it from, vegetables or nuts, I know Brazil nuts are common. Where else can we get selenium from in your diet?
Yeah, absolutely. So selenium does exist naturally in the soil. So there's going to be, those plant-based sources. And you're right, Brazil nuts is probably, or maybe the one people are most familiar with. Interestingly, many types of mushrooms, like shiitake, button mushrooms, are good sources. Many green vegetables, but then also seeds and barley, both good sources of selenium. Uh, as I mentioned, animal products are good sources of selenium as long as the dietary sources for those animals have been selenium containing.
So if you're taking selenium, is there any reason to monitor selenium levels? Should you check selenium to see if you're deficient when you're diagnosed with thyroid disease? And how do we know if we're getting enough?
Selenium deficiency, fortunately, would be very rare, and levels of selenium less than 7 micrograms per deciliter are consistent with severe deficiency. And deficiency often would take place when the intake is less than about 10 to 20 micrograms per day. Probably the measurement of selenium in most patients in that case, isn't going to be necessary. We're unlikely to find selenium levels in patients who aren't at risk that are really going to be indicative of severe deficiency that we know are going to be associated with thyroid problems necessarily. Certainly if someone had some compatible symptoms, clinicians should always be aware of the possibility, I think. As far as monitoring thyroid hormone status or making management decisions, our thyroid function testing, such as TSH or free T4, are going to be far and away much better measures of the treatment that people need than what a selenium level would be. So generally, I would say there's no need to be checking or monitoring levels in that setting, or in people taking supplementation, as long as we have no reason to be concerned that they're now have toxicity.
Tell me a little bit more about if you're taking selenium with, say, your levothyroxine for Hashimoto's or methimazole for your thyroid eye disease. Is there any sort of interaction with selenium and these medications?
That's a great question. And I would counsel, all patients who are taking any sort of vitamin that they need to take it, significantly removed from their levothyroxine. We often say 2 hours, maybe even 4 hours later, if someone's taking a multivitamin, iron, calcium, those sorts of things. Now, I haven't found anything that clearly shows that that is an issue with levothyroxine absorption in selenium. But in the absence of really being sure that there wouldn't be any effect on absorption, I would still make the same recommendation to people that to make sure that it's separated.
Okay. We talked a lot about thyroid eye disease, right? So we briefly touched on Hashimoto's. Is there any role for selenium for Hashimoto's?
Selenium and Hashimoto's, I think, is a place where we have maybe the biggest body of evidence. And there is really some compelling evidence about the effect of selenium on Hashimoto's in terms of antibody levels. But unfortunately, I think there are some real caveats to this that I would want to bring up. Okay, so prospective studies of selenium supplementation and the effect on TPO antibody have been done for a couple of decades. And some have showed significant effect and some have not. And so that has led to several meta-analyses about this. One meta-analysis of 11 randomized controlled trials showed a significant reduction in TPO antibody levels. And the effect was greatest in patients who had highest or higher baseline levels of TPO. Most recently, in 2024, the Catalyst study was a double-blind, randomized, placebo-controlled study of adult patients with TPO antibodies that were elevated, greater than 100 in that study, and taking levothyroxine, who were treated with 200 micrograms per day of selenium or placebo. And that confirmed a significant reduction in TPO antibody in the selenium group compared to the placebo. But I think what's important to recognize about the potential immunologic change that's causing TPO antibody to be lower is that this hasn't translated into more concrete clinical benefits. A separate randomized controlled meta-analysis of 5 randomized controlled trials looking at other thyroid variables did not find any effect on TSH level, thyroid appearance on ultrasound, or quality of life. And if we return to that Catalyst trial, the primary outcome was improvement in quality of life after 12 months of selenium therapy. And there was no difference found in either the composite score or the hypothyroid symptom score. And additionally, they didn't find a change in free T3 to free T4 ratio that might be indicative of conversion, and no change in the levothyroxine dosing that people needed. And so there's apparently a benefit on reducing antibody levels to somewhat. We don't know how valuable that might be, but we aren't seeing sorts of outcome changes that would really make this a effective and recommended treatment for people with Hashimoto's.
Okay, so I just want to make sure I understood. Does a great job at reducing TPO levels, but it doesn't really lower your dose of thyroid hormone requirement. It doesn't really, on a population basis, improve any of the symptoms of hypothyroidism, of brain fog and weight gain and just feeling generally run down. And it doesn't prevent you from getting started on thyroid hormone replacement in the first place. So really the benefit is just entirely on paper reducing TPO levels, which may have some benefit not related to thyroid, but it from the thyroid perspective, it's just decreasing those antibodies, correct?
Correct. And this is probably something pretty common. We can see that sort of preclinical evidence. We know that there are things happening in the cells that selenium is affecting, and how do we translate into a clinical treatment? How do we find a clinical benefit? Sometimes our studies aren't able to, but that's the evidence that we have right now.
Where do you think the research is going in the future? Is this being researched more? Do you think it's more research will come out?
I would assume so, because again, there's so much interest in this topic. I will tell you that of the many patients that I see with Hashimoto's, so many of them ask about it, a way to cure it, a way to get rid of it, rather than dealing with hypothyroidism itself. And so I think the sort of smoke that we have related to selenium and the mechanisms of autoimmunity is something to pursue, even if we don't have the fire yet.
Okay, so more to come maybe in the future. We'll have you come back and give us an update in a couple of years. I know we covered, so now we've covered Graves' patients, the thyroid eye disease, Hashimoto's patients. I actually have a lot of cancer patients that ask me about selenium. Is there any role of selenium in patients with thyroid cancer or in patients with nodules to shrink nodules?
So, in terms of selenium supplementation for patients with thyroid nodules or thyroid cancer, there doesn't seem to be nearly the same role that would exist. We've been talking about the effect of selenium on how the immune system might respond to the thyroid. And in patients who have had thyroid cancer, predominantly those people won't have a thyroid anymore after surgical treatment. Um, the role of selenium in having a thyroid nodule is maybe unknown, but there doesn't appear to be any particular role of selenium in thyroid nodules forming or persisting or growing. When we talk about the deiodinase enzymes and the need for selenium in conversion, I think that would apply to anyone taking thyroid medication.
Okay, so this is a wonderful conversation. Thank you for joining. Do you have any last minute tips for our listeners on selenium? What do you do for your own patients in practice?
I think primarily when patients ask about their thyroid disease and what additional steps they can take to try and improve their conditions, I take that very seriously. And I do have a discussion about selenium that goes over some of the data that we've talked about, including the limitations, but that there's really, an available option for them to use nutrition and natural sources to try and benefit their health, with the recognition that we obviously really do want to avoid potential side effects that might exist.
Thank you so much. Thank you, everyone, for listening to this episode of the Thyroid Stimulating Podcast. Please stay tuned to hear about our next episode, which will be on AI and its role in the thyroid.